President Obama has cancelled a trip to the Far East so that he can spend more time trying to gather support for his controversial healthcare reforms. A redrafted bill has been approved by Democrats today and is expected to be voted on this weekend. But persistent opposition to the reforms is testing the president's leadership skills, as our North America editor Mark Mardell reports.
What happens to America's healthcare system has divided a nation and damaged the president. Now the long-drawn-out fight is reaching a climax, and the outcome is critical for Obama's authority.
What's so different is the...
Democratic Congressman Jason Altmire tells me he still hasn't made up his mind how to vote. The biggest issue in American politics now hangs on what he and a handful of other Democrats decide. He's been called from the White House and even from Air Force One.
The president has called, of course, he's called a lot of people on this.
Isn't this in part about his authority? If this goes down, he's very damaged.
I'm not worried about the political implications. I have the competing goals of representing my district and making sure we have good policy. And those two things should be working together. If I have a vote that my constituents aren't comfortable with, I'm not going to be able to support the bill.
So what do his constituents think here in Pennsylvania District 4? It's a suburb of Pittsburgh, a marginal seat. He could well lose in November's congressional elections over the president's insistence on changing America's healthcare system. In Dick's Diner on William Penn Highway, old friends meet across the political divide. He's a Democrat, she's a Republican. John Seco wants his congressman to vote for the bill, but he isn't that keen on it.
I would say it's a garbage can of different ideas, some of which may be good but aren't toned out, others that are bad ideas, and it's all being delivered at once in order for the Democratic Party, my party, to look as though it can lead.
Jill Cooper didn't vote for Obama, but says she expected better.
To me, he looks like someone who is trying to win for the sake of winning, leading, not listening, and I'm very, disappointed.
And the local chemists are called to tell a man his prescription isn't being paid for.
It's saying that you don't have coverage.
He's lost his job, and with it, his insurance.
Because it's pretty expensive. It's $464.
There's general agreement reform is needed, but the owner says this bill doesn't do the trick, and he hopes his congressman will vote no.
I can't speak for the people who come in here, but I know what they're going through with the way the health care is today, and I don't see anything in the current legislation that they're trying to push forward that's going to help that.
The small towns that make up this area aren't rich, and they're not poor either. They're conservative with a small c. What people here make of the changes to health care really matters for the Democratic Party and the future of the president. Mark Mardell, BBC News, Pennsylvania.